Hello whizzes. Welcome to my channel. Today's topic is serology. Serology is the branch of medical science that deals with the study of blood serum and other bodily fluids to diagnose and monitor diseases. It primarily focuses on the detection and measurement of antibodies, antigens, and other molecules in the blood that are related to the body's immune response. Serological tests are essential tools in medicine for diagnosing various infections, autoimmune diseases, allergies, and certain types of cancers. Let's delve into serology in more detail. Antibodies and antigens. Antibodies, immunoglobulins. These are proteins produced by the immune system in response to the presence of foreign substances, antigens, like bacteria, viruses, or toxins. Antibodies help the immune system recognize and neutralize these invaders. Antigens. Antigens are molecules or molecular structures that can stimulate the production of antibodies. They are usually found on the surface of pathogens or foreign substances. Antigens trigger the immune system to produce specific antibodies that can bind to and eliminate the antigens. Purpose of serology. Serological tests serve several purposes, including diagnosis, identifying the presence of antibodies or antigens to determine if a person has been exposed to a particular infection. Monitoring, tracking the progression of an infection and the effectiveness of treatment by measuring changes in antibody levels. Immunity assessment, determining if an individual has developed immunity against a specific disease, either through vaccination or previous infection. Transplantation compatibility, assessing donor-recipient compatibility in organ transplantation. Types of serological tests. Antibody detection, these tests detect antibodies in a patient's blood or other bodily fluids. Common tests include ELISA, enzyme-linked immunosorbent assay, and Western blot. Antigen detection, these tests identify antigens, such as viral proteins, in a patient's sample. They are commonly used for diagnosing infections like HIV and hepatitis. Neutralization assays, these tests determine the ability of antibodies to neutralize the infectivity of a pathogen. They are often used in research and vaccine development. Serum protein electrophoresis, this technique separates proteins in serum to identify abnormalities in protein composition, which can indicate certain medical conditions. Applications of serology. Infectious disease diagnosis, serological tests are widely used to diagnose viral and bacterial infections like COVID-19, HIV, hepatitis, and Lyme disease. Immunity assessment, they help determine if an individual has developed immunity to diseases through vaccination or prior infection. Autoimmune disease diagnosis, serology can assist in diagnosing autoimmune disorders like rheumatoid arthritis and lupus by detecting autoantibodies. Blood typing, the ABO and Rh blood typing systems are serological tests used to determine a person's blood type for transfusion compatibility. Limitations and interpretation. The timing of serological testing is crucial, as it can take some time for the immune system to produce detectable levels of antibodies after infection or vaccination. The presence of antibodies does not always indicate active infection, as antibodies may persist in the body long after an infection has been cleared. Interpretation of serological test results requires careful consideration of clinical symptoms, exposure history, and the specific antibodies or antigens being tested. In summary, serology plays a vital role in diagnosing and monitoring various diseases, especially infectious diseases. It relies on the detection and measurement of antibodies and antigens in bodily fluids to provide valuable information for healthcare professionals in managing patient care and public health efforts. If you like this video, please like, share, and subscribe to my channel. Thank you for watching.